premenopausal women, in other words, women still having their periods, should be doing a breast exam or performing a breast exam about 3 to 5 days after their period finishes on a monthly basis. Women who've gone through the menopause should also, of course, be doing it, but just on a monthly basis at a fixed time. And the rationale for doing it at certain periods, as we know, especially in women who still menstruate, is that the breast texture and consistency changes per month, every month, and doing it at that time of 3 to 5 days is the most accurate way of assessing if something is different. In terms of how we do it, it's relatively straightforward, thankfully, and there are many good articles and videos that you can actually see to help guide you, but the most important thing is essentially inspecting yourself. In other words, looking at your breasts, so being topless and looking at the symmetry of your breasts. Do they look the same? Does one look more swollen than the other? Is there any inversion, in other words, pulling in of the skin or nipple? Are there any skin rashes, especially around the nipple area? So we're looking at basically any difference from the norm. And women who do this on a monthly basis get quite good at understanding what is normal for them. And this examination should be done first with hands by the sides in front of a mirror, and doing all those things that we talked about to look for any asymmetry or anything unusual, and then doing it with the arms above their head, and then doing it with the arms flexed on their hips and squeezing on their hips so that the chest wall flexes, and so you get a good feel and understanding as to whether there is something that is different from the norm. And so inspecting your breasts in those 3 different ways is probably the most accurate way of assessing if there is something different from usual. And then what we want to do is to be able to examine the breast. And that's called manual, and that's called palpation. And the best position to do this, and there are many positions, is probably lying flat, because it distributes the breast and flattens it. And with your right arm by your side, you then, lying flat, bring the left hand onto the right breast, and then in a circular motion using the middle 3 fingers, you palpate around the breast. Doesn't matter whether you do it from out to in or in to out, as long as the whole breast is palpated. And that includes the area from the middle of the chest, or the sternum, the pigeon bone, all the way to the armpit, and above all the way to the collarbone. And as I said, the order in which it's done is not so relevant, but the palpation needs to be initially quite light, and then a little bit firmer, and then a little bit firmer again, until your breast tissue is being essentially pushed against the underlying ribs. And that's to palpate the right breast. And then if you're going to do the left breast, then the left arm will be by the side. Again, you're lying flat, and the right arm comes across to the left breast and does the same thing, feeling all the different quadrants or the different areas within the left breast, as we mentioned before. And that is something that's really important, because once you know how to do it, it becomes quite routine, and women do pick up lumps by self-examination, so they can alter their prognosis. So this is an important question, because we know that the longer a woman is exposed to her menstrual cycles, the more there is in terms of exposure to estrogen, which is one of the drivers that can trigger a breast cancer. So women who start their periods very early, especially before 12 years of age, or women who stop their periods, in other words, go through the menopause at more than 55 years of age, they tend to have a higher risk of breast cancer because they have been exposed to estrogen longer. And that's why, conversely, women who have less periods, in other words, those who have multiple pregnancies especially, or early pregnancies, or breastfeed, they tend to have a lower risk of breast cancer. So the duration of menstrual cycles and the frequent duration of menopausal is particularly important. Let's start with the environmental factors that increase the risk of breast cancer. Some of these will be very well known to people, and they include smoking, active or passive. There are also, of course, dietary factors such as processed meats or charred meats, alcohol consumption, especially more than 1 glass of alcohol per day for a woman increases that risk of breast cancer in many studies. Then there are lots of environmental factors that play a role in terms of chemicals, or gases or fumes. So air pollution, exposure to gasoline, exposure to pesticides, although a lot of these are banned now, exposure to dioxins, which are the products of fuels such as wood and coal when they're burnt. Certain occupations, and there are many, can expose you also to breast cancer. In particular, people who work in the textile industry are exposed to chemicals like aromatic amines, and transport workers may be exposed to high levels of polycyclic aromatic hydrocarbons. Those are just some of the occupational risk factors that are associated with breast cancer, although a lot of the risk factors that we mentioned are essentially environmental, to do with alcohol and smoking and diet. This is a difficult, debatable question. Much research has shown that there is a link between lower levels of vitamin D and breast cancer, because vitamin D is believed to play a role in regulating cancer growth, cell growth, and also in terms of regulating the spread of cancer or the metastasis of cancer. So there's a large body of evidence that points to lower levels of vitamin D in women being a risk factor. And we know vitamin D is important generally because we need it to absorb calcium into the bone. So it's important for bone. It's important for the immune system, and the immune system also in terms of helping fight cancer. It's also relevant in other processes and organs around the body, including muscles and skeletal tissue. So it's a vital vitamin, and you can increase your vitamin D levels quite easily. There are recommendations of, for example, 15 minutes a day, 3 times a week out in the sun will increase your vitamin level to a normal daily requirement. Vitamin supplements such as vitamin D3 can also be used, and anything above 600 units a day, although be careful because many multivitamins contain only 400. Diet, so things like fatty fish and eggs and milk, fortified milk, play less or are less effective at raising vitamin D levels. But yes, vitamin D is certainly a crucial, or believed to be a crucial factor in terms of cancer regulation. Physical activity is important. We know that physical activity can reduce the risk of a cancer by about 20%. And even in those who have breast cancer or have had breast cancer, it can reduce the risk of it coming back, recurring, or spreading. So exercise is particularly relevant because we know that exercise can reduce levels of estrogens and other hormones such as progestogens and leptins that are important in terms of regulation of cell growth. And reducing these types of hormones can certainly improve someone's risk of a cancer not recurring. And there are many guidelines. There are bodies that recommend, for example, that women do 150 minutes of moderate activity a week, or 75 minutes of vigorous activity, and 2 sessions of 2 or twice weekly sessions of muscle building. So there's a lot of things that people can do to help themselves in terms of exercise, even when they're sitting down. And the NHS, for example, has NHS sitting guidelines, exercise sitting guidelines that you can review and see that will help you do exercises even when you think you can't. And then there's lots of very broad, general, logical things that you can do. So, walking more, and it's believed that 1 hour a week may be sufficient. Although some authorities believe 3 to 5 hours of walking a week is particularly beneficial. And that may help a lot of people who can't go to the gym or who don't want to run a marathon, for example. You can also, of course, help yourself in terms of diet, which is linked to exercise, of course. Avoiding smoking as much as you can, as we mentioned, or not just active, but even passive smoking. So there are things that you can do at home, certainly in terms of physical activity, diet, reducing exposure in your environment. Reducing alcohol is also another important factor. So women who drink more than 1 glass of alcohol per day, for example, will be at a higher risk. So trying to reduce that a little bit can play a big role.